Welcome to Public Health Brief. One bite. One scratch. That's all it takes. Rabies is one of the deadliest viruses on Earth, yet it's 100% preventable if you act fast. In today's Public Health Brief, we're breaking down the life-saving steps you must take if you're ever exposed to rabies. No panic. No confusion. Just clear advice that could save your life, or someone else's. Let's start by understanding what rabies truly is. It's a deadly virus, one that attacks the central nervous system, affecting the brain and spinal cord. It's primarily transmitted through the bite or scratch of an infected animal, often a dog, but it can also be spread by bats, foxes, raccoons, or other mammals. The virus is present in their saliva, and once they bite, it enters the body, silently traveling through the nerves toward the brain. At first, it may seem like nothing serious, just a scratch or bite. But once symptoms begin, the outcome is almost always fatal. So, how do you survive rabies exposure? The first rule is, do not wait for symptoms. This virus doesn't give you a second chance. By the time a person begins to feel the effects, headache, fever, confusion, hydrophobia, it's often too late. But here's the powerful truth, rabies is preventable, even after exposure. The key is immediate and informed action. Imagine you've just been bitten by a stray dog while walking through a neighborhood. It looks harmless, maybe even familiar, but it bit hard enough to draw blood. It happened so fast. You're in shock. Maybe you're wondering if you're overreacting. But this is exactly the moment to act, not later, not tomorrow, not after watching the dog for a few days. Now, the very first step, the foundation of rabies survival, is wound care. It may seem simple, but it's incredibly effective. Wash the wound thoroughly with soap and running water, vigorously, for at least 15 minutes if possible. Use whatever clean water you have, tap water, bottled water, or saline solution. The goal is to physically remove as much of the virus as possible before it can move deeper into the body. Soap helps break down the virus particles, and clean water flushes them away. If antiseptics like iodine or alcohol are available, apply them generously after washing. This one action, prompt and proper cleaning, can significantly reduce your risk of developing rabies. But even after thorough cleaning, you're not safe yet. The virus could still be present, and only post-exposure prophylaxis, or PEP, can offer the full protection you need. PEP is a life-saving combination of a rabies vaccine series and, in some cases, a shot called rabies immunoglobulin. The immunoglobulin provides immediate, short-term antibodies to neutralize the virus, while the vaccine helps your body mount its own defense over time. Getting PEP as soon as possible is critical. Time is your enemy in rabies exposure. The longer you wait, the more time the virus has to spread through your nerves, and once it reaches your brain, nothing can stop it. Now picture this, you're in a rural area, far from any major hospital. Maybe the nearest clinic is a few hours away. Maybe you don't know if the animal was rabid. But you feel okay for now. Should you wait and see? Should you monitor the animal? The answer is a loud and urgent no. Rabies doesn't offer the luxury of time. You must assume the worst and seek PEP immediately. The cost of waiting can be your life. This is where public health education becomes so vital. Many people in the world still don't realize how deadly rabies is, or how preventable it can be with the right knowledge and access to care. In many regions, rabies still claims thousands of lives each year, especially in children who are more likely to be bitten and less likely to report it or receive timely care. Often, the victims didn't know how serious it was, or thought traditional remedies would be enough. Others were unaware that they needed to visit a health center as soon as possible. These tragedies are avoidable, and that's why this message matters. When you reach the clinic or hospital, explain clearly what happened. Share as many details as possible, the type of animal, whether it was domestic or wild, its behavior, the date and time of the incident, and how the bite occurred. If the animal is owned, and you can locate its vaccination records, that helps guide the decision, but never let the uncertainty delay your treatment. In areas where rabies is common, health professionals will often begin PEP without waiting for confirmation, because every minute lost is a risk taken. PEP usually involves a series of rabies vaccine injections over a few weeks. If you've never been vaccinated before, you'll likely receive a total of 4 doses, on days 0, 3, 7, and 14, along with the immunoglobulin on day 0, injected around the wound site and into the muscle. If you've previously been vaccinated, you might need only 2 booster doses, and the immunoglobulin is not required. Your healthcare provider will guide you through the schedule, and it is essential to complete the full course. Stopping midway, delaying doses, or skipping any part of the treatment can be dangerous. Your body needs time to build immunity, and following the schedule is what keeps you alive. You might be wondering, What if the wound is very small, or the bite didn't even break the skin? What if it was just a lick? Here's the truth, even minimal contact with saliva can transmit the virus, especially if there are any cuts, scrapes, or mucous membranes involved. If a potentially rabid animal licked your eyes, nose, mouth, or broken skin, that still qualifies as an exposure. It's not about the size of the wound, it's about the virus's ability to find a way in. Sometimes, people underestimate the risk because the animal seemed fine. But rabid animals may not always behave violently. In fact, some may appear unusually friendly or docile, especially in the early stages. Others may show odd behaviors, like restlessness, aggression, drooling, or trouble walking. But you can't rely on appearances alone. If there's any suspicion at all, play it safe and start PEP. One of the hardest realities is that once rabies symptoms begin, like confusion, agitation, hallucinations, or paralysis, there is no proven cure. Medical support can ease suffering, but almost all cases are fatal. That's why prevention is the only weapon we have. And prevention doesn't just happen at the moment of exposure, it also happens through public health systems, vaccination programs, community awareness, and responsible pet ownership. Dogs are the main source of human rabies deaths globally, accounting for up to 99% of all human cases. That's why vaccinating dogs is not just about animal health, it's a public health priority. In regions where dog vaccination campaigns have been successful, human rabies cases have dropped dramatically. Communities can create a safety net by ensuring that all dogs and cats are vaccinated regularly. Rabies is a disease we know how to eliminate, but it requires coordination, education, and commitment. Returning to the individual level, let's say the exposure was from a wild animal, like a bat. Bats are a major carrier of rabies in some countries, and bites can be so small that they go unnoticed. If you wake up in a room with a bat and are unsure whether you were bitten, it's considered an exposure. You might not feel a bite, but the risk is real. Again, the advice is the same: seek medical evaluation immediately and begin PEP if recommended. It's better to be cautious than to gamble with a virus that kills 100% of untreated cases. In some heartbreaking situations, victims don't report the exposure at all. They may be embarrassed, afraid, unaware, or simply don't recognize the danger. They might seek traditional remedies, or wait until symptoms appear, at which point it's too late. Part of surviving rabies exposure is breaking the silence. If you or someone you know has been bitten, tell someone. Go to a clinic. Ask for help. Rabies is not something to keep secret. Healthcare providers, teachers, community leaders, all have a role to play in spreading accurate information. We need to teach children to tell an adult if they're bitten. We need to train health workers to recognize exposures and respond quickly. We need governments to invest in vaccine supply chains, cold storage, and accessible clinics. And above all, we need to keep repeating this message: if exposed to rabies, act fast. Wash. Seek care. Get PEP. Don't wait. Now, let's address another misconception: cost. In some countries, rabies treatment can be expensive, and that creates a barrier. People may hesitate because they fear the price, or because vaccines are not always available. This is where public health infrastructure becomes critical. International agencies and governments must prioritize funding and distributing vaccines, especially in high-risk areas. No one should die from a preventable disease because they couldn't afford the cure. Community health programs, NGOs, and global partnerships are working to make rabies vaccines more accessible, but the fight is far from over. Surviving rabies exposure isn't just a personal issue, it's a community challenge. If even one person learns from your experience and takes action, it can save lives. Talk about rabies with your family. Educate your children. Support local vaccination campaigns. Report stray or aggressive animals. The more awareness we build, the more we weaken rabies' power over our communities. So what have we learned? Rabies is deadly, but it's also preventable. The window between exposure and symptom onset is your only chance to act. Clean the wound. Seek medical help. Start PEP without delay. Finish every dose. And raise awareness so others can do the same. When we conclude, rabies may be one of the deadliest viruses in the world, but it's also one of the most preventable. The difference between life and death lies in knowing what to do, and doing it fast. So remember, wash the wound, seek medical help, and start the vaccine series immediately. Don't take risks. Don't delay. Share this information with your family, your friends, and your community, because the life you save might not just be your own. Our final recommendation is, if you or someone you know is ever exposed to a potentially rabid animal, do not wait. Your first step should always be to wash the wound immediately with soap and water for at least 15 minutes. This one action alone can reduce the risk of infection dramatically. Then, go straight to a health center or hospital, even if the bite seems small, even if the animal looked healthy. Let medical professionals evaluate the risk and start you on post-exposure prophylaxis, PEP, which includes the rabies vaccine and sometimes a dose of rabies immunoglobulin. Do not wait for symptoms. Once rabies symptoms appear, it's almost always too late. So act quickly, finish the full vaccine schedule, and follow all medical advice carefully. If you live in a community where rabies is common, make sure your pets are vaccinated, teach children to avoid unknown animals, and report stray or aggressive animals to local authorities. Thank you for watching Public Health Brief. If you found this video helpful, please like, subscribe, and share it widely. Together, we can save lives, one fact at a time.